Both hand surgeons and orthopedic surgeons have challenging jobs. The hand surgeons, we deal with everything. So nerve, tendon, bone, soft tissue, any sort of issue in the hand, we deal with it. Orthopedics is a little more specialized, but they'll treat, I would say, probably more different joints. So they treat hip, knee, shoulder, ankle. So they have to know kind of all of those areas very well. Whereas we're in one spot, but we have to deal with every single problem.
I find it more challenging to do hand surgery as opposed to general orthopedic surgery just because of the anatomy. It's so tiny and it's so complex.
The hand surgeons would always say that they're working with smaller structures and that's why they have to wear their magnification loops and whatnot during surgery. But we have a lot more body parts to care for and cover, whether it's the knee or the shoulder or ankle.
There's a lot more anatomy in one little small area in the hand that includes tendons, nerves, bone, vessels, and I find that very exciting and keeps me going.
I would probably have to give it to the hand surgeons that they have a tougher overall job. Main reason is because their call schedule can be quite unpredictable, and hand injuries, if you've ever been through an emergency room on July 4th, can be quite traumatic.
The hand function is much more intricate than a lot of other areas in the body, and allowing patients to return to that intricate function is an undertaking.
General orthopedics, you can be treating athletes with an ACL injury, or you can be treating a traumatic injury from a car accident. So general orthopedics is a very difficult field.
Doing a subspecialty of hand, it becomes a little more difficult hand as everything is so confined and there's so many very critical structures in a very small area. I think it to be with hand surgery more exact and more precise than with general orthopedics, although both fields I feel are very important and have their pros and cons.
I think the hand surgeons do a lot of very fine work in a tiny area. As an orthopedic surgeon, we cover a lot more territory, so I'm going to say maybe we have a little tougher job in that we have multiple joints and multiple locations to deal with, and the hand surgeons get to stay in their 1 foot area.